Hello friends, welcome to Creative Medicine. In this lecture, we will learn about
Then, types of mastectomy. We have different types of mastectomy. First, we have simple or total mastectomy. Okay, in simple or total mastectomy, we will do first removal of the breast tissue with nipple areolar complex is also removed with skin. Okay, removal of breast tissue with nipple areolar complex and skin is removed. So this is simple total mastectomy. Then we have extended simple mastectomy. In extended simple mastectomy, we will do simple mastectomy, which is removal of breast tissue with nipple areolar complex with skin. This is nothing but simple mastectomy. So along with this simple mastectomy, we will also do in extended mastectomy. Along with simple mastectomy, we will also remove the level 1 lymph nodes. Along with simple mastectomy, level 1 axillary lymph nodes are also removed. That is extended simple mastectomy. Then we have modified radical mastectomy. In modified radical mastectomy, we remove the breast tissue, nipple areolar complex and skin. Along with that, we will remove level 1 and level 2 axillary lymph nodes are removed. Level 1 and level 2 axillary lymph node removal. So there is removal of level 1 and level 2 axillary lymph nodes. Then after modified radical mastectomy, we have Halsted radical mastectomy. Okay, in Halsted radical mastectomy, here we first remove, there is breast tissue, nipple areolar complex is removed. Along with that, we will remove the first, we will also remove the level 1, 2 and 3 lymph nodes are removed. So along with that, again pectoralis major is removed and also pectoralis minor is also removed. Okay, that is Halsted's radical mastectomy. Then we have extended radical mastectomy. In extended radical mastectomy, okay, in this we do radical mastectomy. That is, we remove the all these are removed. So here we do radical mastectomy is done. Along with that, we will remove removal of internal mammary lymph nodes is done. That is extended radical mastectomy. Then we have super radical mastectomy. So in super radical mastectomy, there is radical mastectomy is done plus removal of, along with radical mastectomy, we will also remove, so there is removal of internal mammary lymph nodes or mediastinal lymph nodes and supraclavicular lymph nodes are removed along with radical mastectomy.
thank you and thank you for watching.